It's probably the most important thing I do as a pediatrician is vaccinate.
Staying healthy seems to be a constant concern for many, but what happens when worry strikes that vaccines may do more harm than good? Joe Evan, chairman of pediatrics at Marshall University's School of Medicine, says a sudden fear of immunizations is backtracking the progress medicine's made.
Measles was eradicated in the United States in 2000. There were no cases. But then you get this fraudulent study, people dropping their guard and not getting their vaccine.
Evan believes people don't see the need for getting vaccinated because they don't see the threat it poses.
That the vaccine program is a victim of its own success because nobody today remembers anybody with polio. But as recently as the 1950s, there were 35,000 cases of paralytic polio a year just in this country.
The debate behind vaccinations isn't even as much of a global issue as it is a national issue.
I see most of our students' entire immunization records. Most of the parts of the world where we get students from, they have very robust and strong immunization programs. It probably goes beyond what many people in West Virginia would have.
Students at Marshall have mixed feelings on immunizations, much like the rest of the nation.
That's why I don't go to the hospital. I don't really take medicines because of this.
I understand people being skeptical of like science and the health profession in general, but I don't see any reason to really fear vaccinations.
Evan hopes the outbreak will help raise awareness in the end.
This measles epidemic is going to open our eyes to, yes, these diseases can come back. These diseases we've had controlled for 20, 30, 40 years. We can't go backwards.
Haley Wade, MU Report.